years. I just want to again say that we have upcoming events in Atlanta. We're going to be in Miami. We're going to be hopefully back in New York in the middle of December. And then even though I've been told that JP Morgan Healthcare Week has been canceled, I'm still going to do something in San Francisco that week. So whatever. Because we're very aggressive. We think San Francisco has great talent, especially in the venture capital space, especially when it comes to AI and machine learning. So just want to get back again. So we're still looking for distressed deals, et cetera. And also, and I'm looking to meet, especially if you're in California, entrepreneurs under 40 who are already exited and are looking to do another entrepreneurial pursuit, and they've had successful, significant exits. So who are not looking to get into venture capital, but are looking to continue operating, because I think those are great guys. So so let me introduce Eric Singer. I'll let him introduce himself and what he's talking about. But Eric's I've known for many years. He worked closely with many family offices in the healthcare space. Healthcare is very interesting for family offices. The reason why is that probably before 2012, I would say less than 5% of the family offices were looking at healthcare as a direct investment, and probably it's more than 30% right now, because there was a significant uptick in the 2010 post era. So Eric's a great guy to know. He's got great resources. I'm gonna let him speak. Eric.
Just while I take the podium, I'm going to be talking for a few minutes, and then I'm going to turn it over to CEO David Kolb. So
I'm going to turn them all on.
Okay, so you'll turn them on. Okay, I'm very pleased to meet you all today. Marty's a little bit like an old shoe for me. I get to come back and feel comfortable. I think I started coming to Marty's events back in the mid 2000s, in the mid 2000 teens, and I'm pleased to say that I've worked consistently on one company for a bit, and that company is Neotx. In 2016, I came to Marty's group and I presented the Neotx Series A. We ultimately raised $9 million for that. In 2017, I came to Marty's group to raise money for the Neotx Series B. We raised $9 million for that. In 2019, I came and presented to Marty's group, and we wound up raising $45 million with our lead investor, Larry Ellison. So it's been, I have found Marty's group to be better educated and more engaged than most of the family office groups that are out there. And I can't say enough about Marty as a networker for all of us. Yeah, so basically, the last round of valuation, we raised money at a $45 million pre-money. And as I mentioned, we got Larry Ellison in, Tom Hill, who was a founder of Blackstone and the vice chairman of Blackstone came in. Hank Greenberg, who was the founder of AIG, came in. So I'm very happy to come back and spend a few minutes on Neotx, and then I'm going to talk to you about Petrogen and let the CEO of Petrogen talk to you about it, David Kolb. I'm also here, by the way, today with Matt Tiermont, who's recently joined me. Matt has 10 years of biotech background at SAC and at J. Goldman, and will now be doing investment banking with me. It's important to take a moment and go through the AHOF. Okay, if you're going to be a biotech investor, you have to be aware of the acronym Hall of Fame. Going back to the early 2000s, it was VEGF. In the mid 2000s, you heard the phrase PD1 and PDL1. Then more recently, the acronym of choice was CAR-T. And I'm going to say it to you here. You will have heard it here first. Then about 2 or 3 years from now, the new acronym will be STR. What does STR mean? It means selective T cell recognition. And that's what Neotx does. They have a drug that functions by attaching a superantigen, in this case a fragment of Staphylococcus, to the fetal receptors that are on the surface of tumors and not many very healthy cells. The name of the drug itself is naptumomab. We call it NAP. And because we make cancer look like a bacterial invasion, the body's own immune system responds in force. It's a little bit like a jujitsu moment. And just to give you a perspective on it, if you're familiar, if you've heard the phrase CAR T, CAR T is kind of, I mean, it's very impressive technology, but they take cells out of the body, engineer them to find a particular target, and then put them back into the body. When they do that, they're re-injecting into the body about 10 million cells. To give you just a perspective of why we think that this can become such a powerful platform, you have in your body about 40 trillion cells, and 80 billion of them are T cells, and there are hundreds of T cells that we have categorized. In reality, there are probably 20 million different kinds of T cells looking for 20 million different variations of bad proteins and bad things in your body. When you have a bacterial infection, when the body thinks that staph is coming into the body, staph, if it was actually staph, it's not actually staph, it's a fragment of staph, but because the body recognizes it as a fragment, every new T cell that's made is one that knows how to recognize staph. So at its peak, you have about 30% of your T cells recognizing staph. So that's an army of 24 billion T cells going out and looking to get into the tumor environment and fight battles. And that compares with the 10 million for CAR T. So the advantages of our STR platform are that you get T cell expansion, you get T cell trafficking to the tumor. It's very difficult for T cells to actually get into the tumor. The microtumor environment is often very suppressive and closed. And we think that our approach will open up the tumor microenvironment and allow T cells to get in there better. And one of the things that we think is most promising about our drug and our platform is that we allow epitope spreading and we help to teach the T cells about how to fight the cancer and get different categories of T cells, not just the ones that recognize staph, to adapt to the cancer and to fight it. So we believe that we help to encourage a reboot. Because this is a novel mechanism, which can be used in conjunction with the major cancer fighting modalities, we think that we front on all three major areas of how to fight cancer. We think our drug works well with a checkpoint inhibitor. AstraZeneca has agreed to give us free supplies of drug and is the co-sponsor on our trials in Israel. We think that we have preclinical data that suggests that our drug works well with CAR T and may enable the CAR T drugs to work on solid tumors. Right now, they work very well on blood tumors, but not on solid tumors. And we have clinical data that shows that we help chemo treatment as well. The status of what we're doing is that we have completed a phase 1 dose escalation trial in Israel, and out of 9 evaluable patients, these are all stage 4 patients that had 4 had a response, including a complete response in a very difficult to treat cancer indication, and a partial response in a very difficult to treat cancer indication. And what was most exciting is that we have clinical data showing that there were no T cells in the patient's tumors. So these were cold tumors, and we were able to make them hot tumors. We were able to infiltrate them with T cells, and it's a common expectation that once you make them infiltrated with T cells and you're using the checkpoint inhibitor, the checkpoint inhibitor rearms the T cells and they can go and kill the cancer. So we believe that we can really do some damage to cancer. If you're a family office and you're an institutional size investor, I would urge you to get in touch with me. My email is esinger@bradleywoods.com. My phone number is 212-203-5134. And I would urge you to get in touch if you want to learn more about that. It's with very great pride. So that's just a thumbnail on Neotx. They do have a website. The company is spelled Neotx. And I would urge you to get in touch with me if you have an interest in doing something very significant in cancer. And we'll be raising money. We're going to be raising money at a level that's probably gives our prior investors somewhere between a 10x, a 5x, and a 10x at this point. So I'm very, very proud of the work we've been able to do there. Next, it's with great pride that I announced that the next deal that I'm going to work on. And the truth about biotech is that it takes a long time. Sometimes you have to come out with real preclinical data, clinical data. You got to put it into people. It's not just whether the dogs eat the dog food. With biotech, they actually have to have objective results. So these things sometimes take time, but they can be incredibly rewarding. And I was very fortunate to have David Kolb, who was the entrepreneur in residence for Yale for biotech, contact me and say that he wants me to help him and Yale University find a way to commercialize one of their technologies. And it's in a completely different area than oncology. It's in periodontal disease, which is an area that from a competitive point of view is just it's much easier to come in with a new drug in the world of periodontics because the existing drugs that are used are very ineffective and the techniques are relatively old-fashioned. Petrogen Therapeutics has a great founding team, scientists out of Yale and the NIH. It has a biology that's already been demonstrated in humans, which is a rarity. Now we're just searching for the exact right compound to promote that biology. And as I mentioned earlier, we think that it's a wide open field in terms of competition because the leading drug in the area, Reston for gum disease, has very modest results. There are 30 million people that are affected by gum disease, so it's a big market in the US and it's a very big market worldwide. And finally, the trial design that's going to happen for it is it's a very straightforward trial design. So the endpoints on it we think will allow a very good chance of success. So it's valued like an early stage biotech, but we think it's actually got much less risk than the normal early stage company. And with that, I'd like to turn it over to David. And David, I've known David for 25 years. Has studied biology and business at Yeshiva University. And David, I'd like you to give the rest of your background and tell people about why this is such a great opportunity. Thank you.
Sure. Thank you so much, Eric. Thank you. So, started out my career first decade or so in life science investment banking. Had the opportunity to work on about $2.5 billion in deals, about 100 plus kind of deals. And then after the first decade, I decided that I wanted to switch gears and move into the entrepreneurial space. And I've started 4 companies since then. The first was a spin out of Harvard Medical School that ended up getting sold for $183 million to Supernus. That was in the pediatric epilepsy space. The second was focused in wound care. And that one, I'm still the chairman of that company, and we've gotten some great data, great clinical results, and we're talking to some strategic investors at this point. I'm not going to get into the other ones as well, but I have it on the slide. You guys can feel free to look at it. But really my passion is finding science at the academic levels and really, bringing that along as an entrepreneur in residence at Yale and taking that science and bringing it to a commercial point and building spin-outs. So what I'll do is very briefly put up some slides that will help you kind of understand the Petrogen story. Hopefully everybody can see this. And so really Petrogen starts out and is born out of the lab of Demetrius Braddock, who's a well-known enzymologist and professor of pathology at Yale. He's a leading expert in ENPP1 biology. And so ENPP1 is an enzyme that produces pyrophosphate. Pyrophosphate controls the mineralization in your body. So think bones, teeth, things like that. So this technology and this knowledge in biology allowed him to address a rare disease problem where certain children are born with a mutation in ENPP1. And so this mutation actually leads to calcification in the body. So it's the rare disease is called GACI, general arterial calcification in infants. And so it's a terrible disease. Most, if not all patients, don't really live beyond their first decade. And so he had developed the technology around ENPP1 and spun out the company into a company called Inozyme, and he's a scientific founder. The company raised 110 million in venture capital from some of the leading venture capital firms, and then raised another 120 million in a recent IPO. It's just been a complete success story, which is I'm so proud of Yale and Demetrius. for doing that and helping those rare disease patients. And so what's interesting is that in the course of doing that work on ENPP1 biology, Demetrius had discovered that patients, if you look at the graph on the right, the boxes on the right, patients that have GACI and have this calcification also happen to have a very strong buildup in what's called cementum along the side of their teeth. And so Demetrius thought, he said, you know what, that could be good for periodontal disease. Maybe something good could come out of this as well on the flip side. And so he brought in expertise in periodontal disease from the NIH and additional expertise in biochemistry from Yale, and pulled together this team to work on this problem using ENPP1 as the target. And so brought in Martha Summerman, who's a very decorated NIH person. She's been there for more, I think, almost 2 decades. She's the former director of the NIH's dental section and is currently the chief of the Laboratory of Oral Connective Tissue Biology, won many awards and has developed a lot of periodontal disease models. And then also brought in Enrique de la Cruz, who's also a very well-known biochemist at Yale, who's also won several awards. And so I kind of put the team together to think about how to address periodontal disease using ENPP1. As I mentioned earlier, so ENPP1 produces pyrophosphate. The way it works is if you see this PP, right, these 2 phosphates. So essentially what it does is it takes ATP, which is the energy, the triphosphate that we all use in our bodies. Everybody's kind of heard about ATP from high school biology. So it breaks ATP down into pyrophosphate, which becomes a mineralization inhibitor and balances things out in your body in terms of mineralization. So the idea here on the biology is to take an inhibitor of ENPP1 and use it to inhibit the production of pyrophosphate, which in turn will now produce cementum. And we're going to do that locally at the tooth level, which will, again, hopefully replicate what we just saw in humans. So again, as Eric pointed out, it's not very common to see a proof of concept on the biology in humans and then apply that now to a disease. It's usually the other way around. You have a disease, you have a theory, you have a hypothesis, you start with animals and you work your way up to humans. Here we've already got the human proof of concept, as you can see again on the left. And so this was again replicated in multiple mouse models to actually see, hey, if we knock down ENPP1, are we going to get the same results? And we did. And you can see that here. You see the yellow is the cementum. You see it's much thicker and much higher than in the wild type mice, the ones that did not have ENPP1 knockdown. So, is another mouse model example as well. And you can actually see how thick, so that's AC is acellular cementum. You can actually see how thick that gets relative to wild type mice. So that's really important for periodontal disease, where the biggest issue that people face is that pocket depth between the tooth and the gum gets bigger and